Newsom's House Calls this month is all about empowering women to get their mammograms and do their breast self-exams. And that's a challenging message for some women in our community because of cultural and language differences. Samuel U. Rodgers Health Center is the perfect place for those women to get help. We have Paula Hoffman here and also Renee, Jeria, they're both with the Breast Care Center at Samuel Rodgers. And Renee, you can tell us so much about the challenges that women face. Tell us a little bit about these language and also cultural barriers to getting screened.
Absolutely. We're so multicultural at Samuel Rodgers. During the course of a day, I'm the mammography technologist. It's very rare that actually a patient of mine would speak English. Several different languages. One of the cultures that I find the most barriers with is our Somalian population. A lot of times they just, they're very guarded, they're very protected, they're coming in for a screening mammogram. Screening is something new to them a lot of times. They're not used to seeing the doctor unless there's a problem. So I find it wonderful that we have time to educate also. We've got people in the building that work for translation, or we have the language line that we can call, and we can really take the time to explain to them why screening is so important, that we find breast cancers early.
It's so important. You have state-of-the-art technology as well. I mean, Samuel U. Rodgers serves a lot of the indigent community, but your facility and your breast center there, Paula, very state-of-the-art.
It is. We have digital mammography, and we also have an amazing ultrasound unit that is able to get that second look or a different look at something. So it is very state-of-the-art.
Both of you actually have a connection with breast cancer that really drives your passion to help women get their mammograms. Tell us a little bit about it, Renee.
Yeah, I've been a mammography technologist for over 20 years. I have always loved what I do and been very passionate about it. However, 10 years ago, I was diagnosed with breast cancer myself. Wow,
so you're a survivor as well. 10 years for you?
10 years,
5 for me.
Absolutely.
And Renee, your passion, tell us about that.
So my mom actually fought breast cancer 5 times over 18 years. She was a pioneer for many of the drugs that are out there, like Herceptin, tamoxifen, and so my passion definitely comes from that.
We have some video of your mom. Tell us a little bit about her and why it inspires you to make sure that other women get screened.
Well, my mom was diagnosed back in 1992 when you didn't really talk about these things. It wasn't an everyday occurrence that you talked about. She actually found a lump and she went and talked to her doctor. Luckily, she had a great doctor that knew what to do and have her screened. And she went on to have a mastectomy. And then she also created a support group, and she did several things. She was a patient advocate for herself. She knew that sometimes when a doctor said, oh, we'll just wait on this, she would say no. And we discovered as a family that we really need to do that for her also, which really got me into being in the healthcare, is wanting to do more for my patients and realizing that patients are our family and they're not just numbers. So that's why we're so passionate about it.
That's beautiful. Thank you both so much for what you're doing. How can people quickly get involved? Can they call? And if they need financial help, you guys have some free and low-cost mammograms as well, and services that you provide for people who don't have money. Just quickly give us a phone number or a website or something.
Absolutely. You know, we have a sliding scale. We have grants that we take care of. The best phone number to call to get an appointment would be?
I would say to call Angie McGee, which is our breast care coordinator, and her number is 816-889-4708. And get a hold of her, and she can kind of lead you through how to be seen.
All right. Thank you so much, both of you, for coming. You're going to be on Newsom's House Calls at my home, so if you have more information that you want to get from her, you can definitely tune in on Sunday. You're coming by the house.
Yes.
All right. Thanks, ladies, for coming.
Thank you.
Thank you.